Hello, this is Maria Alexander. The date is August the 29th, 2024. Nursing 711 Advanced Physiology and Pathophysiology. And my subject today is H. pylori, cancer risk factors. This is a 62-year-old Latino male who presented with persistent weakness, fatigue, and lack of energy, and this has been going on for approximately 3 weeks. He has no complaints of abdominal discomfort or pain. Patient reports he seems to have heartburn more often despite taking medication for GERD. He denies vomiting, weight loss, swelling in his abdomen, and early satiety. Lab results show CBC red blood cell count at 3.2 million, hemocratic at 31%, and hemoglobin concentrates of 10.1 grams, and his fetal occult blood test was positive for blood. The average level for RBCs is 4.7 to 6.1 million for men, and a normal hemocratic for males is around 3.8 to 48.6, and a normal hemoglobin is 13.8 to 17.2. Gastrocarcinoma, is the third leading cause of death worldwide, with H. pylori is a significant risk for factors along with smoking, diet, stomach surgery. People with H. pylori infections are prone to having gastric cancer. There are 4.4 billion worldwide who are positive for gastric cancer, mainly in Africa, Latin America, the Caribbean, and Asia. Males have a higher risk of pylori. In 2018, the incidence of gastric carcinoma worldwide was over 1 million new cases, with approximately 783 deaths. To Panda 2021, H. pylori affects factors that speed up adhesions, movement, inflammation, and effectivity within the host stomach lining. It interferes with the host's immune response and cytokines functionings, using these methods to invade and stay in the stomach lining for a long time. The human body identifies H. pylori as a foreign invader and triggers an inflammatory response to eliminate the bacteria. The chief complaint today is persistent weakness, fatigue, lack of energy. HPI is benign prostatic hyperplasia, asthma, gastroesophageal reflux disease. His family history is mother, aged 82, type 2 diabetes, mellitus, and hypertension. His father expired at age 52 from acute myocardial infarction. Two sisters aged 60 and 64 are well. Maternal grandmother died from breast cancer, and aunt passed away from complications of secondary colon cancer. Social history: he's a music professor. He lives alone, and his wife passed away 6 years ago. He is a smoker. He smokes 1.5 packs of cigarettes and drinks brandy Manhattans daily. He eats many processed foods, and he likes hamburgers, and he likes to eat weenies especially. He has no regular exercise, but walks some. His allergies are aspirin. It gives him an upset stomach. His medications is omeprazole 20 milligrams by mouth every other Q day. He takes imetropium by 2 puffs QID. Trimazolone MDI 2 puffs QID, albuterol MDI 2 puffs PRN, Terezazine 1 milligram at night QD. Objective data is overweight. His blood pressure is 120/95. His pulse is 78. His respirations are 15. His temperature is 98.5. Weight 182 and height 5'6.5". He looks slightly pale. He has a slightly pale conjunctiva. Adam soft but tender to touch. Genitals and rectum. Enlarged prostate. His musculoskeletal extremities, spooning of fingernails, limit of range of motion in the upper and lower extremities, consisting with degenerative joint disease. His serology positive for H. pylori antibodies. His peripheral blood smear is hypochromic, microcystic, and erythrocytosis. Endoscopic reveals a 5 cm times 3 cm mass in the upper stomach, near the junction of the esophagus and stomach. Biopsy reveals endocarcinoma, and endoscopic ultrasound shows that it's penetrated through the walls of the stomach and it invades the lymph nodes. Abdominal CT positive for multiple levels of lesions. Liver lesions, lab results, low iron level 34, normal levels 8 through 180 mcgs, average in male. His TIBC is 720, normal is 250 to 460. His ferritin is 8, and normal levels for males is 12 through 300. And professional, the ARNP provides spiritual support and shows compassion and empathy. If the patient is willing, prayer and scripture can comfort him. The ARNP can also assist the patient with making faith-based decisions concerning his cancer and offer different services that would benefit him and give him the best quality of life. APNs exercise clinical leadership in the ability to influence teams and make complex decisions autonomously. Stage has a gastric progressed. The gastric cancer progressed. Is the 5 years survival probability for this patient greater than or less than 50%? What disorder is suggested by the patient complete blood count? Listening to my presentation, I hope that you got something out of it. Thank you.